Good morning. Good morning, and welcome to part two of trauma informed integrative approaches to treating eating disorders via telehealth. For those of you that were with us yesterday, welcome back. And for those of you that are with us for the first time, welcome. Please utilize our chat feature if you have any questions or comments for our presenters, as we will make time to answer those questions before the completion of the presentation. Also, don't forget to utilize your dashboard to get your surveys and your links to your CE certificate. So without further ado, I will turn it over to my colleagues. Thank you.
Welcome, everyone. So happy to have everyone here today. Like Jamie said, if you were here yesterday, welcome back. If this is your first time attending the session and you weren't able to attend part one, welcome. We're going to make sure that this is a standalone presentation so that we're not going to cover everything that we did yesterday, but you should be able to just pick up right where we are, even if you weren't able to make it yesterday. But really quick introduction, I'm Emma Riebel. I'm a primary therapist within health located in Central Florida. Jackie and Caitlin, do y'all want to introduce yourselves real quick?
Definitely, yes. Hi, I'm Jackie Rangel. I am also a primary therapist at Within Health and also located in Florida. I'm in Miami.
Yes. And I'm Caitlin Kelly. I am also a primary therapist at Within Health, and I'm also an art therapist and yoga teacher. So I am in Virginia.
Awesome. Well, really quick overview of what we did yesterday. If you missed it, we went over kind of the basics of trauma-informed telehealth, how to kind of set up the telehealth relationship and medium in such a way that it is protective of clients' histories and of the risks and kind of things that can potentially come with telehealth. And also how to capitalize on the benefits. So we laid that foundation. We went over psychodrama. And then today, I'm really excited. We're going to be able to get into breathwork with Jackie. And then we'll also do some art therapy with Caitlin. But really quick, we wanted to share the objectives. So Jackie, whenever you're ready, we can slide those on by just so that we have them. Okay, yeah, so we want to be able to speak to the benefits and risks of providing treatment for trauma via a telehealth platform. That was more yesterday, but today we're still going to talk about the risks and benefits of the two modalities that we're going over, breathwork and art therapy, via telehealth. We want to, again, this will be integrated today, though it was mostly covered yesterday. Explore strategies for creating a safe environment for trauma work via telehealth, particularly with the population of patients with eating disorders. And then we also are going over specific trauma interventions and their applications via telehealth. So with that being said, I think we have one more slide, I believe, just that we went over yesterday. That I think is important to just kind of revisit, and then we'll let Jackie take it away. But the big part of why we're exploring telehealth, right, and trauma treatment via telehealth is because we truly do believe that being at home and being in treatment can be powerful. It can come with risks. It can also come with great benefits and great opportunities that honestly aren't always accessible to people. Otherwise. So we want to talk about all of the wonderful things that can come with being in treatment and working through trauma in one's home environment, and also prepare in such a way that we're able to mitigate any of those risks. So Jackie, take it away.
Thanks, Emma. So we're going to start off talking about breathwork today. And breathwork is I don't want to say a buzzword, but probably something that, you've heard more and more throughout the past few years. So it has its roots in ancient cultures all across the world, but modern applications, are seen in kind of these different branches of mental, emotional, physical, and spiritual well-being. So you see people in different fields using breath work for all kinds of different purposes. Ideally for kind of a combination of all of these, really. So interoception is this term that if you were in Rebecca's presentation yesterday on internal family systems, she was spending a lot of time going over. So interoception is basically like our sixth sense in some ways of being able to really tune into what's happening inside of our bodies. What is our internal experience at all times? So poor interoception, difficulty regulating emotion, but the opposite is also true. Increased interoception increases our ease in regulating our emotions. So, a little mini breakdown of breath work and the physiology. We could spend days on this, but to kind of keep it nice and simple, I really like this quote here on the left that sums up for me why breath work matters in a lot of ways. So, the breath is the link between the conscious and the unconscious processes in the brain. So, when we look at our inhale, which we take voluntarily and involuntarily, we're creating space, right? So we're getting this expansion, blood flow is decreasing, and heart rate is elevating as a response. That stimulates sympathetic activation. When we're exhaling, we're doing the opposite, right? That's where we bring on our voluntary sympathetic, also happens involuntarily. We're decreasing the space. You can think of your chest kind of pulling in as you exhale. Blood flow increases, and as a result, your heart doesn't have to work so hard. So diaphragmatic breathing increases heart rate variability, which is what we want. So your HRV, your heart rate variability is, like if you think of a minute, you could take, if you're beating 60 beats per minute, you don't necessarily want those beats spread out like 1 second, 1 second. We want some variability. Increased variability is, you can think of like increased window of tolerance for your nervous system. So the slow diaphragmatic breathing, which I feel like all, we're pretty comfortable with that term as mental health providers, of letting this little parachute structure that is your diaphragm come down, expand, and that looks like breathing into the belly. So, right, when we say breathe into your belly, obviously you're not sending air all the way down here. But what you're doing is that you're giving space, this parachute's coming down so your lungs can expand bigger. So the way that the diaphragm is structured physiologically allows us to control it unconsciously and consciously. So purposefully and by accident, I guess. Like it's going to move whether you're thinking about it or not. But that link, I kind of always tell clients like paying attention to your breath and bringing it online into your awareness. Doing it on purpose allows it to go into the background, functioning a little bit more on your side and a little bit more with you. The more attention that we pay, the more it's kind of like doing us favors in the background is kind of how I like to frame it. So a lot of potentials for emotional processing with breath work. Intense breathing patterns, connected breathing, which we're going to go over a little bit, that is not necessarily exactly where you take clients right away, but they can help to disrupt rigid neural networks in the brain. And the idea there is to kind of create some space and release those patterns. So that looks like getting at unresolved emotional conflict and trauma-related disturbances. So breath work has been likened to EMDR in this way, in that it's thought to kind of get us to these core traumatic memories, difficult thoughts, difficult feelings, and process them in new ways. Something that also happens when we're in a connected breathing pattern is that we can get into transient hypofrontality. So our executive function, right, this kind of like I am me and you are you, and this is how I'm supposed to behave in the world, gets to slow down for a little bit. And when that slows down, I like to like explain it to people like the emotions that you didn't get to feel earlier because it wasn't convenient to cry at work, come online and you get to process those things. Or, it wasn't convenient to, have that difficult conversation with your partner in public. And, we store those kind of like go into the background. that transient hypofrontality allows for deeper levels of emotional processing to occur. Really great PTSD outcomes with breath work. These are just two examples. So this first one, the 2014 war veterans who were recovering from PTSD at the 1 month mark with just really simple breathing techniques, not even kind of this connected breathing where we're getting to core traumatic memories. We saw a significant reduction at the 1 year and 1 month mark. More recent case study was examining PTSD in firefighters, and after just 8 sessions of connected breathing, which is that more intense breathing pattern, we're going to tap into that just a touch in a little bit, that the comorbid symptoms were in complete remission along with their PTSD. So really promising outcomes. I will say that for this case study, that requires a readiness and kind of a willingness to lean into the discomfort that can come up with breath work. So getting to those core memories, those core disturbances is confronting. So, that being said, not all of our clients are ready for that, and there's screening that definitely has to happen with that. And, just additional special considerations. So first one is dissociation. We talked about this a little bit of screening. The dissociative experiences scale can be really helpful for this along with a couple of other screening tools that Emma reviewed yesterday. Pregnancy, we don't have so much research of what happens with breath work, or I guess kind of like more trauma-directed breath work and unborn babies, but I always say it's not my interest to find out. Epilepsy, counterindicated as this breathing, again, kind of just disrupts the prefrontal cortex is going to kind of slow it down, and we don't want to disrupt that in someone who's regularly having seizures. Glaucoma, detached retina, these are kind of the standard ones. I put water here. So what you might find in just a moment when we get into some breathing is you're like, oh my gosh, I can hold my breath for so long. But this is not the kind of breath work that you want to do when you're underwater, because you can kind of lose a little bit of track of time, space, and that's not helpful when you're underwater. Different kind of breath work is used for free diving, holding your breath for long periods of time underwater, but not this one. Elevated surfaces, again, kind of like losing track of time, space, maybe falling asleep. We don't want someone doing their breath work. I like to have my clients laying down, but not necessarily on a surface where they could potentially roll off. And comfort, really important, to sort of do this deeper work that comes up. So, comfort looks like not only, cozy pillows, blankets, all of the external, but also, are you in a safe environment? Are you with someone that you trust? I was doing a panel recently, and somebody was asking, it was somebody in recovery saying, I don't like doing breath work because I don't think that somebody has the right to tell me when to breathe and when not to breathe. And I said, excellent, then this is not for you at this time. There are thankfully so many modalities that we can use for healing. But breath work has to be voluntary for it to be effective, just like, almost anything else. If we don't think it's going to help us get better, it's probably not going to help us get better, and can even be, disturbing if you're not ready for it, if you feel like you're under duress. So, I say comfort to also highlight the relationship and the level of trust that you have in someone, not only kind of having training in the practice of breath work, but just the kind of human connection level of comfort. So that's really important to establish, especially at this virtual level where, some of that warming up, like Emma was talking about yesterday in psychodrama, takes a little bit more time. Another kind of consideration I don't have listed on here, but is things to help when the client is feeling very triggered. I actually have been working with one of Caitlin's clients who has been very has this experience where we'll go into her breath work. She feels very, very relaxed, but then coming out of it has a very intense, has just a very activated response. So we've been keeping a little cup of ice by her bed when she's doing her breath work, so that when she comes out and she knows as soon as she starts moving around, she's going to become activated, she uses the ice on her wrist, sometimes on her clavicle. We have a lot of like these nerve endings and just very powerful spots to stimulate for vagal toning. And this is very much helped her kind of de-escalate in those moments and then keep the benefits of the breath work, which, for her, we're looking to deactivate anxiety. So just a couple of special considerations of the virtual level, but also important to know in person as well. Okay, so now's our time. We're going to get into a little bit of a breathwork practice here for just a few minutes to kind of get a little bit of a taste. So if any of these counterindications I mentioned apply to you, you can just take this as a time to close your eyes and kind of tune in, listen, and practice slow breathing. But if you're comfortable and curious, you can go ahead and get comfortable in your seat. Maybe lean back a little bit. Good. And you can close your eyes if closing doesn't feel comfortable to you. You can go ahead and just soften your focus. So think about the inch or so below your belly button. And I want you to think about when I say filling up your belly to breathe into that point. Go ahead and take an inhale through your nose if it's available. And exhale long through your mouth. And do that again, inhaling. But focus through your exhale. Exhale like through a straw. Good. We're going to do a few more of those. Just warming up the diaphragm. Really focus on those long exhales. And thinking about getting the stale air out of your lungs. One more breath into the low belly. One more breath all the way out. Little hold at the bottom. 5, 4, 3, 2, 1. Now we're going to breathe into the low belly. Take a second breath up into your chest now. And on your exhale, don't blow it out, just drop it out. And do that again, going from low belly up to your ribs, expand your chest, and let it go. So getting into a rhythm with it now. Belly, think ribs, chest, let it go. And again, belly, ribs to the side, chest, and let it go. You can continue like that, taking a 2-3 part breath in and out. And again in, letting it go. Good. Continue in this pattern, just like we've been doing. Noticing any sensations that start to come up, a little bit of tingling, lightheadedness, and lean into those sensations. It's just your body integrating more oxygen than it's used to. You're safe. Continue to breathe and follow my lead here. In, let it go. Here for a few moments longer. Few more. Leaning into sensation. Putting a little bit more breath on it. Slowing now, but still 3 parts in. Let it go. Letting go. Good. Keep those last few breaths going. If you're asking yourself if you're doing it wrong, the answer is no. You cannot do this wrong. We're here for 3 breaths. Last one like that. Drop the breath. Good. Now we're going to take a slow breath in all the way to the top. Little pause. And now slow release to the bottom. Exhale through your teeth. Relaxing your shoulders all the way to the bottom. Where we're going to pause, holding the breath. And you're free. You're in control of your own body here. If you need to breathe before I give the signal, go for it. But if you're comfortable, let's hang out here just a tad longer. For 5, 4, last 3, and 2. Take a slow breath in all the way to the top. Feeling your lungs stretch out, sip in a little bit more. Good, a little hold here. This one will be shorter. Just feel your body full of air again. Holding for 5, 4, 3, 2, let it go. Allowing your body to soften with that exhale. And watch as the breath regulates. Find your heartbeat. Notice it returning to a place of calm. Noticing how your body is always trying to go back to that balanced place. And dropping a little bit of appreciation for the fact that it does it without you ever asking it to. Take a breath in. Exhale nice and long. We're going to bring system back down with just a few 4 short rounds of breath. So we'll inhale for a count of 4, 3, 2, 1. Hold for 4, 3, 2, 1. Exhale 6, 5, 4, 3, 2, 1. Hold for 6, 5, 4, 3, 2, 1. Breath back in. Holding 4. Exhale 6. Soften. Holding 6, 5, 4, 3, 2, 1. Twice more in. Holding. Slow exhale. Holding. 4, 3, 2, 1. Last time in. Holding. Sigh of relief. 3, 2, 1. Last little hold at ease. 3, 2, 1. Easy breath in. Maybe letting it out with a soft smile. Take a moment here, pausing with yourself. And when you're ready, start to bring your awareness back to the space that you're in, where you're sitting. Maybe blinking your eyes open as you're ready. So hopefully that brought up some sort of sensation for you. I'm not going to name it as calm, although it's nice when calm happens. But all sensations are welcomed in breath work. It's, again, the goal is interoception, just awareness of what is inside, what's happening there. With increased interoception, right, we become a little bit more comfortable with whatever does come up. But thank you guys for following if you did. And for your time, Caitlin's going to take over with art therapy here. Kind of building.
Thank you, Jackie. I loved that. So, and that will, it's kind of the primer for what we're going to do in art as well, too. So, art therapy, we have our definition here. But a lot of times, I hear oh, I love doing art, I'm doing art therapy. And there is a difference between art as therapy and art therapy. So, art therapy is specifically a mental health field, which is facilitated by an art therapist. So, someone that's trained at the master's level, maybe even more, to work with art media, the creative process. Um, and the resulting artwork to explore the feelings that come up during the process, after the process, before the process, which can also help us to explore our emotions, increase our self-awareness, um, and then also manage certain behaviors, and also help to interact with others. So it can help with our interpersonal skills as well too. It can also help to work with reality orientation, and reduced anxiety and increased self-esteem. So that's kind of just the baseline. I think most people probably that are here probably know what art therapy is. You'd be amazed at how many the wild things that I hear when I say, "Oh, I'm an art therapist and I work with individuals that are struggling with trauma and eating disorders." No, it is not drawing pictures of food sometimes, but that is one that I get a lot. So no, it's really more about the process than the product. And one thing that I always say too is anyone can do art therapy. So many people that I hear come to the process say, well, I'm not an artist, I can't do that. And so I just want to kind of really let that go. You don't have to be an artist to do art therapy. So yeah, so if you want to go to the next one. So, what are some common goals that we use specifically for supporting trauma recovery using the art process? So, if you see here, here's a whole bunch of different art interventions. Art therapy can look very different. It can be 2D, it can be 3D. And so, a lot of the goals that we use specifically are with the intention that when we process verbally, our the verbal processing is in a different part of the brain than the experiential processing. So I was always taught as an art therapist that where our emotions are stored are also in the brain is also where the artistic process develops. So a lot of times it can feel a little bit more safe to do some of the trauma work because there is that distance, kind of that layer between talking about something. So it's a great place to start with grounding, safety, and containment. So if you're thinking about the triphasic model of trauma recovery, it's a great art therapy is a great tool to use, because if I can create art within that makes me feel safe, if I can feel safe within the creative process, then I know that I can feel safe within my own body. Even if it doesn't feel accessible often, I know that it's there and I'm going to start to rewrite those neural pathways. So it's also great for when we create a piece of artwork, we are externalizing what is internal. So in the same way that we do that when we talk, then we also have this image of what I felt in that moment. Exploring our boundaries. We can do that with the artistic process. We can do that with the art therapist. You can do that in the physical space. And as we know in trauma recovery, boundaries are so, so important. It's kind of, one of those buzzwords. So it also really helps to channel impulses. So we'll talk a little bit about it, but the sensory and kinesthetic aspects of art therapy can really help to have a physical way of getting it out. There's something just really physical about taking a paintbrush and, getting it out like that. Like that feels different to me than saying, wow, I'm really mad. So, it can also help with distress tolerance, increase interpersonal skills. It really helps with body awareness as well, just like the breath and the psychodrama as well too. Sometimes when you interact with a certain material or you interact with the art medium, it brings out a sensory experience, so a felt sense that we may not get from just the talking process, which can also help in turn to help us to self-regulate. And it can also help us move out of the role of the victim. So there's something really powerful about creating an image that is kind of like this timestamp and is so visual and visceral that other people know, hey, this is what I felt, or this is my hope for the future. So it can be really helpful to move into those roles of survivor and thriver. So, and these are just some. There are so many other goals that can be individualized to each person that's doing the process. So, how do we create the virtual art space? So, my training is such that Judy Rubin, this comes from Judy Rubin, who those of you that may not have heard her name, if you are familiar with Mr. Rogers, that show from back in the day, if you know who the art lady Judy was from Mr. Rogers, she is one of the pioneers in art therapy. So that's a little fun fact for you. And so basically what she taught and what many of us art therapists are taught is that the art therapy space, the art room, is really crucial to creating a safe space. So, if you've ever had, whether even if you weren't in an art therapy group or in a space, if you've ever had the moment where you walked into a physical space and it was like super cluttered and you just feel the sensation in your body of like, oh, I need a breath, or oh man, if and I hear from a lot of my moms and myself when I come in, like, oh, I got to clean that up, I got to do this. So having a space that feels safe to the clients in terms of what materials you are accessing, cleaning it up, not just, am I going to slip on some paint, but the idea of, does this feel safe? Are the materials here going to trigger me? Certain materials can be regressive, certain materials can elicit certain experiences. So, kind of before telehealth and before all this, the art therapist had so much control over what the art space looked like. And now the truth is we have less, because we are not in your physical home, or, we're not in our clients' homes. So when the pandemic happened and we moved to virtual art therapy, there was kind of this buzz among art therapists of like, how are we going to make this work? Like, I can't recreate the smell of an art room in your home, which we can't. But I think about polyvagal theory, and we talk about this idea that things that were once adaptive, when we do not move on from them based off of the current needs, then they become stuck points. And so what art therapists have had to do is basically say, so how do we make it safe in your room? So how do we shift this to, this is now your art therapy space. This is no longer your kitchen table. This is a space where we're going to have containment, safety, and grounding. And so we do that through a lot of ways. Sometimes, we have a great art therapist here at Within, Martine, and she has organized, art boxes that we send ahead to our clients here. That's something that I do in my private practice as well. Or making sure that our clients have access to certain materials. It's so much easier to just have everything physically in our art room, but it can also be empowering if a client has the resources to be able to go to the art store to feel that empowerment. The idea of also creating ritual for containment. So different art therapists do this in different ways. Sometimes, we'll do a 2-minute check-in, create a mandala. Sometimes we will, have a bowl of beans where you write down, what am I bringing to the session? And I put it in there and I leave it in there. Sometimes it'll be doing some breath work. Sometimes it'll be, working on, pressing a spot in the ear, which activates the vagus nerve. Lots of different ways to do it. But if we create that ritual for containment, it can be really powerful. And, I joke, I had a client here at Within, and at one point she said, it's, 3:43. You're going to ask me how I feel right now because we're about to end in 2 minutes. And it kind of became this joke, but it also it created safety because she knew exactly what was coming when. So as part of that too, creating the sensory and kinesthetic experience of the art space. So I have, ask my clients, like, have a box for your art materials, have a space, use it in a way that you can feel safe and comfortable. Like, what does it feel like? How do you engage with the materials? Different art materials can elicit certain responses. So I don't know if you'll be able to see this with the screen, but for those of you, does anyone know these? Like, think, for those of you that know what this is, does it elicit a memory? Does it give you a reaction? I see Emma kind of smiling. I have some clients that are like, do not get me near that black one, because these are scented. And a lot of people use these growing up. And so even just looking at that visually can elicit a response. Different things can elicit different responses as well. The smell of crayons, things like that. And so letting our clients know, hey, you may have a reaction to this. My daughter, she touches glitter for too long. It's like, we are activated, we are out. So, reminding our clients and creating that space for them as well. Knowing that certain materials can elicit certain emotion. And as an art therapist, we might say, okay, I see that you have those crayons there and you can use them. I'm also noticing that we're working with a really hard emotion right now. And as an art therapist, I may not recommend that because that may put you into a regress state. I might use different language depending on the age of the client, but, so just working with our clients in that way. Something that's also pretty important is, do I, as the art therapist, what do I do when the client is making artwork? I choose oftentimes to make side-by-side artwork. So I'll just, nothing super deep. It's not about me, but just, exploring the medium. Sometimes my clients like to tilt their screen so I can see their art process. And sometimes my clients want me to see them. But one of the difficulties in the telehealth art room is that you can't always have both. But asking the client, what do you feel more comfortable in? And also, if it's a client that, here, maybe shaking their leg or moving around, we want to make sure, hey, I do need to be able to see X part of your body while you're doing this. So different considerations for where you want the screen during that process. Also, my teens that I work with are like, let me text you this picture. And so I have to remind their parents, text messages, not safe for sharing images. So, working on that encryption, also storing the artwork. So in the art therapy space, in the art room, we have a portfolio. And I come in, I do my work, we contain the session, I put it there, I leave it there. And so I can encourage my clients in the art therapy process to make sure that they have their own portfolio or, use an altered book, use, something that they can close and contain. Because I always say, like, art therapy work is not necessarily the imagery that you're going to post on your refrigerator. And that's okay. And so just setting up that expectation for like, this is private. This is, think about that artwork as part of your clinical portfolio, your clinical chart, excuse me. So, and then also the idea of, in the physical art space, we get to show our artwork, but because, maybe it's hanging up, maybe it's on the drying rack, we have that sharing time. But when we are in our own homes, we don't always have that experience. So sometimes I have clients that like to share their artwork on social media. If that is their choice and they want to do that, that can feel empowering. I've had clients, say, I'm going to take this artwork and I'm going to do an art exhibit. And that's really empowering as well, too. So different ways of creating that connection that is inherent in the physical art space that are not inherent in the tele-art space. So a lot of different ways to do it. You want to go to the next one? All right. So today we are going to engage in, I'm going to say that this is going to be art as therapy because I am not your therapist. And I'm not going to be processing and containing it with you at the end, but I will offer a space for you to do that for yourself. So we're going to do an experiential, kind of, building off of the breath work that Jackie did. We're going to be doing something called, we're going to be drawing our breath, and I'm going to walk you through different types of breathing in the moment. So as you're doing this, before you're doing this right now, if you don't have any art materials, grab whatever you have available. It can be pens, it can be, if you have paint, it can be Sharpie, it can be, crayons, whatever you have. There's no wrong way to do it. Just have whatever is accessible to you. If we were in an art therapy space, we might have, you might have your art box. So you might have a lot of different options as well, all across the expressive therapies continuum. So as we're creating this imagery, I want you to think about, what material am I choosing if I have the privilege of choosing a material? Do I want to offer a material, or do I want to choose a material where I have a lot of control over it, like a Sharpie or a pencil, or do I want something that is really fluid, like watercolors? What color do I want to use? And, a lot of times people will say, what if this is red? My child drew a picture using red. What does that mean? I'm like, nothing. Ask your child. Like, the red is not anything. It just means whatever that person's intention is behind it. So choosing the color for you. Line quality. Is it fragmented like a, think of like an EKG? Is it fluid? Is it organic? And when you make your mark, do you want to do it quickly? Is there implied energy? Is it, da, 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 is it, slowly taking my time? Are there loops? How much pressure am I using? Is there a lot of perseveration? Do I want to imply lots of energy? So a lot of different things we can think about. Those are just some things. So if you want to go to the next one. So for those of you that are here, we're going to start. I know that many of you, if you did the breath work with Jackie, hopefully you should be in a space where you feel connected, to yourself in this moment. But when I do this with clients, I like to do a little bit of a warm up as we do, just to create that safety and containment. So I'm going to model that here today. You may not need it. If not, it's up to you. So, and just like what Jackie and Emma said, this is your body. You are in control. So if I say something that's not for you today, don't do it. You get to choose. So, all right. So I'm going to invite you to close the eyes or focus on one spot around the room that's not moving. See if you can uncross anything that's crossed. If you can, place your feet on the floor or your back touching the chair. If you can't have both, try to choose one that makes you feel more grounded and connected to this moment. I want you to start by, with your eyes closed or gently drawn, I want you to start by noticing the noise that's the furthest away. So potentially the noises outside of the room that you are physically in. Maybe the wind blowing, maybe a person outside, maybe cars, maybe if you live in an apartment, someone walking in the hallway or an animal, whatever it might be, with a detached sense of awareness, just try to notice it. So starting outside of our own awareness of our own body. And then bring your awareness into the room that you are physically in. Maybe imagining your body as a color, a heat, a temperature. Imagine your body in this room taking up space. Notice the noises that you hear in this physical space. Perhaps my voice, perhaps air conditioning or heat, perhaps an animal, maybe your computer's humming, whatever it might be. Just notice with a detached sense of awareness. And then bring it in a little bit closer. So notice what's happening right around your body. The space right on your chest as you breathe, rising and falling without trying to manipulate the breath, just noticing your natural breath pattern. Maybe your shoulders, create a little bit more space between the tops of the shoulders and the earlobes as you exhale. Maybe there's a slight temperature change around the nostrils. Whatever it might be, just notice. We are not trying to control it right now. I want you to notice the rise and fall of your breath. Notice what's happening inside you. Become connected to your breath, again, without trying to change it. We're just trying to get an understanding of what your baseline is right now, in this moment. Doesn't mean it's this way forever, but just in this moment. Now, I want you to think about those aspects of color, line, form that we discussed earlier. I want you to gently open your eyes, take your paper, and choose a line that might represent the rise and fall of your natural breath. And go ahead and pick that. And then moving forward, I'm going to ask you to imagine yourself in different situations and we're going to draw the breath. So if I ask you to imagine something that doesn't feel comfortable to imagine, don't do it. So go ahead and close your eyes again or focus on one spot around the room that's not moving. I want you to think about the feeling that you get on a Friday afternoon right before work or the night before a big holiday or event. Kind of that excitement that you have in your body, like something's coming. When you're ready, I want you to notice how your breath may have changed or imagine the way that your breath might be and depict that onto the page. Maybe using the same color or different color. And if you have access to different materials, you can mix it up. Think about the pressure, the mark making. Now, when you're ready, go ahead and close the eyes again. I want you to think about that transition where, we just did excited. Now I want you to think about what does it feel like in my body when I'm actually nervous? So not quite anxious, but just a little nervous. Maybe the feeling right before you're about to give a big talk or, you're about to meet an old friend that you haven't met before. You're about to stand up to someone that you trust, but still feel nervous to express something to. Now, when you're ready, open your eyes. And I want you to capture your breath and align that way. And now, if it's comfortable and safe, go ahead and close your eyes. I'm going to ask you to feel that sensation of anxiety. So maybe the pit in your stomach or a lump in your throat. Think about a time recently when you felt anxious. Maybe it didn't feel good. Notice what happens in your body when you put yourself in that position and you're intentionally feeling that sensation. Did your breath pattern change? Now I want you to take that breath and create an image, create a line. Maybe there's some loops, maybe it's jagged, maybe it's fragmented, maybe I'm holding my breath, maybe there's no line. Or maybe you're cool, calm, and collected. And so letting that go, I want you to think about the sensation after anxiety. So maybe a sense of tiredness. It's Wednesday, you have a long week to go, you're exhausted, you overdid it over the weekend, and you still have to keep going. You're tired. What does your breath do there? Create that image. Just a couple more. We're moving along, close the eyes. I want you to think about the feeling of anger or frustration in your body. So maybe you just made the perfect cup of coffee. It's amazing. You can't wait to have it, and then you drop it on the floor. Maybe it's a different sense of anger. Whatever feels more safe to you, anger or frustration. Notice what happens in your breath. Notice what happens in your holding. I want you to externalize that by creating a line to depict that. When you're ready, close the eyes, let that frustration go. If you can, I want you to think about a sense of calm in your body. You're on the beach, you're in your place, you're completely relaxed. You're with your people or alone, whatever feels best for you. Just calm. That feeling after, if you like massage, after a massage or a sauna or a yoga class or whatever you do to feel relaxed. Now open your eyes and create that image, create that line. Would it be soft? Would it be slow? Would you be using organic shapes? Would there be sharp edges? What color would you use? And then one more. Close the eyes. I want you to think about the feeling of safety. This may feel like calm. For some people, it doesn't. Maybe a place where you feel safe, a moment, real or imaginary. Notice what happens in your body when you bring yourself back to that image. Notice the rise and fall of your breath. Notice the holding. Notice the release. Notice if you feel supported in your chair. And allow yourself to come back to this room, back to this space, feeling supported by whatever is underneath you today. When you're ready, go ahead and open your eyes and create that image. This is our final image. And then Jackie, would you mind clicking the next slide, please? Thanks. All right. So this is where, if we were doing an art therapy session, but here alone, with yourself alone, we're all together. That's the whole beauty of telehealth. I want you to ask yourself, what did I see? What were those images that I saw in my mind? What did I hear? What did I hear in my body? What did I hear around me? What did I hear in my mind? And what did I feel? So notice, you can go ahead and look at your artwork. Notice the differences. For some of you, there may be a marked difference in the line quality. For some of you, there may not be a lot of variability. And, once kind of looking at this and seeing the externalization of your breath, sometimes it can be helpful to remind yourselves like, wow, I really am in control of my breath. I was sitting here in this situation and the power of my mind was able to evoke a certain response. And so what does that mean? That means that I am in control of my breath. I can do breath work like, that Jackie had to kind of bring me into my mind, into my body. I can use imagery. I can use psychodrama to feel more in control of myself, my body, my story. So, yeah, there we go. That is what I have. So now we have, I think we have about 5 minutes. This is really a space for, we wanted to answer any questions, hear any responses.
Thank you so much, Emma, Jackie, and Caitlin. I am going to go over to the chat feature to see if we have questions. And it looks like we do have one question that is anonymous. So whoever wants to take it, you guys can decide. But this question says, do you find that doing art therapy and breath work in a virtual setting can be more difficult than in a traditional treatment environment?
I can start with breath work. I think in some ways, yes, it's nice when I'm like close to a body and I can see what it's doing. I think that there's also a co-regulation that happens in person, right? So the person close to me is kind of like attuning to my breath a little bit more easily. And at the same time, I feel like it's really powerful for people who might otherwise be a little shy to explore that kind of modality in person, or, um, I think especially with people integrating traumatic memories, it can feel very safe to have your own space, right? Like your own room that like maybe you put the lock on, and you like, your blanket, your like, you don't have someone, close to you, and like all these factors that maybe feel out of control. I think it can feel very nice to, um, yeah, just have it a little bit more private in that way.
Mhm. Same, basically the same response. And I'm thinking of, I have a client right now, a teenager who I'm the only member of her team that's virtual. Everyone else is in person. And her presentation is so much more open through the virtual setting. So I think it really depends on the person. But yes, I mean, there are definitely there are challenges and there are benefits as well.
Yeah, I'm trying. Oh, sorry, go ahead, Jamie.
No, go ahead, Emma, please.
No, I'm trying to remember. I recently did a training on this for the uh, anyway, NBCC board certified telemental health thing, but I think there's a word I can't remember if it's the telehealth disinhibition effect or there's a disinhibition effect that
Yeah,
can happen
that makes sense.
when you work, yeah, when you work virtually. And you saying that, Caitlin, reminded me. So, I mean, it just it depends on the client. Sometimes we have to do a little bit more work to draw them out. Sometimes they're actually really open. And I know for me, I've felt more connected to some of my clients virtually than I have otherwise because we're in their homes, we're in their lives in such a more real, authentic way. And with that being said, when we do trauma work, we also have to adapt, especially with these modalities for the telehealth medium.
We do have one comment. The comment from one of the attendees says that the good thing about being able to do it virtually, do you find that it helps create a safe space in the home where the home has sometimes been a trigger point for a lot of clients?
Mm, I think that's a really good point of, having these kind of grounding and processing experiences within the home can, change your entire experience of a space of like, wow, this is a place where I healed. This
Yeah.
this place has brought me joy and safety.
Yeah, I think about, polyvagal theory, the neurons that fire together, wire together. So if I can create safety in my home where I usually like had the neurons fire and telling me that I'm not safe, now I actually can rewrite that neural pathway. So I think that can be really powerful.
Mm, absolutely.
Well, thank you so much to the three of you. This was an amazing presentation with a lot of information and a lot of resources. I appreciate you all. Thank you to our attendees. Before we close out, just want to remind you that you will receive a survey at the completion of the presentation. You will have your link once the conference is done to download your certificate. So if you have not received a link to download the certificate, it is because you will get that once all of the surveys have been completed and all of the CE sessions are done. So don't worry that you have not seen that link yet. To our presenters, thank you again, and I will see you all in the next session. Have a great day.
Thanks, everyone.
Thank you.